Yeah, my name is Pape Gaye. I'm with Intrahealth. And as Marianne said, some of the work I'll be talking about today, a lot of it was inspired from the work we did with the Capacity Project and that we continue to do after Capacity, obviously. I'm originally from Senegal, and I've been in the field of international development for quite a while. So let me begin, first of all, gathering like this are always a celebration. Our community is working very hard, and it is nice to come together to take stock about where we are. And as you know, the human resources for health is of particularly interest. But let's begin where we should begin, which is by recognizing the formidable work that you do and by saluting each one of you for not only choosing to work in HRH, but choosing to lend a hand to those vulnerable people around the world. You are in this room because you care. You are in this room because you want to make this world a better place. You are in this room because you believe in investing in people. And that's why we're here. That's why this subject is so passionate. And we know that unless we resolve some of the major issues around human resources for health, our hope for reaching universal health care really going to be slim. This is why we are worried, this is why we care, and this is why we want to focus actually on partnership. Partnership is the right thing to do because this field is complex, but it's also exciting. The field of international development and the field of global health has changed so much in the short last 10 years. Just look at how the field has changed and recognize that with me, and you will agree that partnership is really the way to go and that none of our institutions alone can do this. Look at who's come into the field in the last 5 years. Look at the number of social entrepreneurs that have entered this field. En masse, so many of them, mostly millennials, you will say, but they do think that they can do it faster and better. And they tend to be a little more impatient than the traditional NGO. But they are here, and we need to find a place to include them in their partnership. Look at academic institutions. Academic institutions are wanting to get into this field, and they want it to really have their footprint, and they want to do it in a way that is more effective than they've had in the past. Look at the private sector. Just about 10 years ago, there was still a lot of resistance about the private sector. There might still be resistance, and there might still be a little bit of hesitation and suspicion, but the private sector is here to stay. That train has left the stations, right? And we know that if we manage to harness the potential that exists in the private sector, we will have the resources and the scale to finish the work. So, and then you've got people who are now saying, of course we're all saying, we cannot just solve this problem by remaining alone in our health sector. Fortunately, in the health sector, we're a little bit spoiled, and we're very siloed. So I think the task at hand as we move forward would be how do we get out of our silos? How do we do a better job at reaching out to the other sectors that we need so badly to finish this agenda? But before we do that, let's also celebrate, because this is about celebration. We are making progress, and your work is paying off. You've managed in the last few years to reduce maternal mortality. We are talking about few 100,000 to go. We have halved child mortality. In some places, we're beginning to talk about malaria elimination. You believe the number of people we have put on ARV today. So if you read that report, that Lancet 2035 report, it talks about this convergence by 2035, where we're going to reach, our community is going to manage to help us take non-communicable disease at a level that is quote unquote acceptable. We're going to be reducing it to a level that we can manage. Of course, we have non-communicable diseases coming up. So the profile has changed. The epidemiological profile is changing and has changed a lot in the world. So clearly, we've got new actors, new change landscape, new epidemiological profile, but also a lot more energy. That is why we're excited that if we succeed in solving a lot of these human resources for health crisis, the problem, we can be there. We can be at a good place, at a better place. We can provide contraceptive to more women. We can lift so many people out of poverty. So as I see it, as we start this conversation on partnership today, I see two major issues at hand for us. One is to do the unfinished business, which is to really lift people who are still in extreme poverty, who get up every morning to say how they're going to go through the day. That is just not acceptable. That we can do better. That we can really, really eliminate. But we're on the way. We are cutting the rate of poverty down. We can do it. That's half of the job. The other half is to make the point we need to be making that health and human resources and investing in human resources is the smartest investment we can make. That is actually where the excitement is, especially for sub-Saharan Africa and the rest of the developing world. We want to make the case that if we invest in human resources for health, it is not just an expenditure, just expenses like we used to think. It is an investment. It is an investment that's going to yield not only healthy population, but people who are ready, who are productive, who can help not only make this world a better place, but who can make the dream of prosperity reality. That is where the excitement is. And to do that, we need to do things differently. And we need to partner differently. And that's what I wanted to just take a few minutes to make a case for what we need to emphasize to reach universal health care. Because it is really the stuff we need to do. We need to reach universal health care. So these are the challenges that we have, in my opinion. We need to find a way to increase linkages with small and rural partners. There is a failure to focus on primary health care. Let's face it. 2006 was when we put the crisis on the map. But then, since then, the HRH crisis keeps getting worse. You know, we were talking at those days at a shortage of 7 million. We are now talking, if you factor in the SDG, a shortage of 18 million. So it's going backwards. And I think we made a mistake by not focusing on primary health care. So I hope we take this opportunity to do that, and that our partnership thinking will include the goal of strengthening primary health care. Rural connectivity and communications continue to be an issue, but progress are being made. Partnerships are, at their heart, relationships. That is really what we're talking about. How to build this strong relationship between all the actors, between all the communities that we need to reach. There are some recommendations and solutions that I hope we will focus on. I hope we will focus a lot on local partnerships. I hope we will not forget faith-based partners, because traditionally these are the groups that have been there for a long time. And in many countries, they continue to really deliver the bulk of healthcare to vulnerable communities. I hope we can have more centers of excellence, because that's a good model. Just to share, this is a picture. It's probably hard to read from where you are sitting. A lot of collaboration is going on. A lot of partnership is going on. This is drawn from the MEPI experience. Professor Amaswa, I think, is supposed to be here. Maybe he'll address a little bit of that. But there was a great example of north to south collaboration. That project basically links Northern University with Southern universities. There are also a lot of South-to-South collaboration, as you will see if you are closer to this map. You will see that there's a lot of collaboration between African universities and Southern universities, etc. This is just a Kintampo Rural Training Health Institute. Anybody from Ghana here in the room? No? That this would be a case of drawn from a Kintampo Rural Training University, which vision was to be a world-class health university that responds to health needs of community. That's all I have, actually. I just wanted to set the stage. I don't have a long time. I was only given 10 minutes. But I hope as we start this conversation, you will agree with me that we need to make a mind shift. We cannot just take partnership that is based on responding to a RFP or an RFA that came out, and let's see which groups can come together. But we really be deliberate, think out of the box, and think about people who are not generally in the room, because partnership with those will be what's going to get us there. Thank you so much.